Okay. My question. I work with patient on chronic mechanical ventilation, and one of the common problem is a lot of airway secretion, um, because because not only because diseases in lung, but because the tracheostomy tube. What you can advise to me to solve this problem? A lot of my patients don't speak at all. 70% of our patients in vegetative state. Mm, and thank you.
Okay. So I'm going to repeat the question so that it's more easier, and it's more easier for me to understand as well.
Repeat.
Okay. Okay, here we are. So Maya asks that, so she's a head of treating respiratory problems in Israel, in Tel Aviv. She asks, I work with patients on chronic mechanical ventilation, and one of the common problems is multiple airway secretion. What you can advise me to solve this problem? A lot of patients don't speak at all. Thank you, doctor. So very interesting question, Maya. And as you already know that we have been in last few years, and especially in the last 2 years, treating many cases, especially respiratory cases in the ICU, in the hospitals in India and in other different parts of the world, especially adjuncting with homeopathy. And you would be very kind of surprised to know that especially the results are better when the patients don't talk. It's because then you depend totally on objective symptoms. You know, there is something called as subjective symptoms, and there is something called as objective symptoms. Subjective symptoms is where patient says that, oh doctor, I feel burning over here. And objective symptom is when you observe. For example, you're observing a respiratory symptom patient, and suddenly he's moving one hand of the body. Okay, why is he moving only one hand? So this is objective symptom. This is very often a keynote of zincum, helleborus, and apocynon. So in these type of cases, you know, what you ask in respiratory related symptoms, multiple airway secretion, there are a few things that I would like to tell you. The first thing is the best book to read it that I want to tell you about is a book called as Coma by Magan Bhai Desai. This is a small book of about, let's say, 30 pages. Okay, of a homeopath, the only homeopath who I know who has documented his cases where he has treated kind of difficult, complicated cases with homeopathy. He was one of the homeopaths, Dr. Magan Bhai Desai, in Gujarat, in India, and he was very interested in treating terminally ill patients. You know, patients who are in last stages and in the hospital, on the respiratory sphere, on the oxygen parameters. So, but Magan Bhai Desai wasn't allowed in many hospitals to give homeopathy. So what he did, he converted his house into like a small ICU. His bedroom had a small, like a few beds. Hall had few beds. His kitchen had few beds, and he in that way admitted many patients in his house only and started treating. And he has documented all these cases. Few things here. A lot of importance will have to be given, and because for me this is by far the best book to understand how to treat pathological last stage terminally ill patients in the hospital. You have to give a lot of importance to past history of the patient. You have to give a lot of importance to past history of illnesses, family history of illnesses. You have to also give a lot of importance to the general state of the patient. And here, understand the deep underlying miasm. Very often in these type of cases, Dr. Magan Bhai Desai, you know, there is a past history of, for example, one patient, there was a family history of many heart attacks and many cases of paralysis in the family. Often pointed towards syphilitic miasm, for example. In such kind of cases, very often he gives syphilinum, 10m, and frequent repetition, sometimes 8 hourly, sometimes 6 hourly for a couple of days. So one technique, and I'm going to show you multiple techniques here. One technique is about prescribing in this technique, which means trying to understand the soil, trying to understand at a deeper level the constitution, and prescribing at this level. This can give a lot of results. So this is more general technique. Another technique, which is a typical technique, is you can do a general individualization, which I'm sure you must be already doing. For example, just right now, recently, I'm treating a very complicated case of a paralysis, of a motor neuron disease, of a very top, I would say a very top person in India. He's admitted in the hospital, and I was already treating him for his motor neuron disease. So I was already treating him with a remedy. I think I was treating with gelsemium, and he was okay. He was improving. But suddenly, he developed a lot of respiratory kind of situation where he developed a lot of respiratory distress. He was put on oxygen. His O2 levels went down. He developed sudden, weakness, paresis, breathlessness. With this paralysis, I took his history again, and I started with a very beautiful remedy. I will just show you. I started with the remedy curare. Curare is a remedy, very beautiful remedy. It is known as arrow poison, and it belongs to Loganiaceae family, same family as gelsemium. And it's one of the very important remedies in homeopathy for paralysis of the respiratory muscles. And there is a very, very bad, distressing kind of dyspnea. So we started with curare. Curare, we started with 200, I think 200, or I don't remember, 1m. And now he's on 10m. Curare 10m, 6 hourly, and he's stabilizing. He's improving. I'm not claiming that he's cured, but I'm saying he's improving. And that itself is a very good sign. Dr. Yash is following up with this case in my clinic. But I'm just telling you that such kind of cases, we can definitely give results. You need to know different techniques. I just told you one technique about understanding the soil, past history, family history. Another technique is probably a kind of individualization. The other technique which I told you about is finding a little bit more local remedies. So for example, if there are secretions, okay, you want to understand the type of secretions. They are more thick, they are more thin, they are more offensive, they are not offensive, they are profuse. Do they come out? They don't come out. I don't know if I taught you this, but I'm just going to give you a very quick example. I don't know if I taught this to the Russian doctors. I taught it to the French doctors. Just trying to find if I can find my lecture on tongues. I took one special session on how to observe tongue. This is very, very important. This I taught to the French doctors about a year back. So give a lot of importance to I give a lot of importance to observations here. I was talking about tongues, different tongues in homeopathy. Just observing the tongue, you will get a keynote about the remedy. And as you already studied Chinese medicine, you know that in Chinese medicine, tongue is a very important role to understand a deeper pattern of a person. Different types of tongues. I'm going to just give you an overview. For example, pointed tongue. Very often the remedy is semisifuga. Posteriorly coated tongue. You see, the tongue is not anteriorly coated, it is posteriorly coated. The remedy is mercurius iodatus flavitus. Cracked tongue at all direction. So these are generally acids, fluoric acid, nitric acid, magnesium muriatic. Varnished tongue, almost like it is varnished, as if it is painted. Can you see this? Very important indication of pyrogen. Dr. Sarkar, my one of my earliest mentor, he taught me about this tongue. He used to take me to hospitals in Kolkata where I lived with him, and he showed me this tongue. He showed me this tongue is pyrogen. Just remember, I want all of you to remember this tongue. If you see this tongue and a patient has a fever and the pulse rate and the temperature ratio is a ratio, pyrogen 1m 6 hourly, you just have to get results. So, these kind of things. You want to give a lot of importance. Indented tongue. The tongue is indented. The teeth is causing indentation. Hydrastis. So in this way, you have to study. There is a very beautiful book called as The Tongue That Never Lies. Interesting name. It's a book written by Dr. Prakash Vakil. He's a very, very senior homeopath. He's no more with us. He was a teacher of my teacher. So he was a teacher of Dr. Sankaran, Dr. Farooq Master, Dr. Vijay Kat. He was a teacher of them. So he was very senior. And he developed a knack of just looking at the tongue and prescribing with very beautiful results. So Maya, there are many, 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 many methods. Maybe at some point, I will create a workshop for all of you where I can teach you how to treat patients in the hospital and how I am treating so many different cases across the world in different hospitals, and how we are just looking at the important symptoms and prescribing in our emergency conditions. Something like that. Varsha asked, pictures are shown in this book? No, the pictures are not shown in this book, but maybe at some point, I'm trying to work on a literature where I can create a book of something of this sort, where you can look at observations and prescribe. But I don't know when that will happen. But if it happens, I will definitely tell you. Dinesh, sir, can you share PDF? I don't share PDFs of books, Dinesh. It is legally, morally, very unethical to share PDFs of authors who have worked a lot on books. To just share it on PDF, it is very illegal. So I don't recommend it for you to do it, and highly not for anyone else. Maya, I hope I was able to give you a little bit of an answer towards your question.
Thank you. Thank you so much. Thank you.
It was a pleasure of mine that you were able to come, and I was able to meet you and see you, because I used to see you all the time, all your group from the Russian. Pleasure to have you. Thank you.
Hello and namaste from Mumbai. I'm very, very excited to share with you that this December, we are launching the advanced course on classical homeopathy. So all the homeopaths out there, students, interns, early practitioners, students anywhere, this is the thing you need to join. It's a weekend course, online course. You can sit at home and learn. In today's times, the world has been online. We are going to be talking about 100 polycrest remedies, also rare remedies, organon, repertorisation techniques, advanced level of case taking. Also, we'll also talk about how to use mother tinctures, organ remedies, biochemics. It's going to be one of its kind. Homeopaths across the world are going to be teaching also in this. And I'm working on the content of it very, very closely with the best minds in homeopathy. So I really, really want every single one of you to join us, be a revolution in this field. I'm also going to give a lot of homework to all of you. So be ready for a lot of training sessions with me. Also, there is an early bird offer. So if you register earlier, you will get it at a major discounted rate. And if you already attended my last course, you'll also in this early bird offer, you'll also get the last course, that is the 6-month classical homeopathy course, as a guest access. We are going to increase it for 6 months. So you'll also attend the last course plus this course. So it's going to be close to about 200 hours of classical homeopathy at your fingertips for the next 7-8 months. It's going to be one of its kind. So if you want to be a genuinely good homeopath and a clinician, this 200 hours will take you to the next level. So forget everything else. Forget the Netflix, forget the Amazon Prime, forget the movies, forget the stories. Classical homeopathy at its best. Just email on the below email ID, register, be a part of revolution. Every single one of you listening, hand on heart, join us.